Hi YouTubers, this is Tammy, otherwise known as Tabasco Girly Girl, coming to you post-op, yay, day 5. I had my VSG surgery on Friday, August 16th, with Dr. Sarangel at John Muir Medical Center in Concord. So just to kind of fill you in on some of the details, my surgery was scheduled for 7:30 in the morning, and I had to be there at 6 a.m. I live about an hour and a half away from Concord, California, so we opted to drive over the night before and stay in a hotel so that we didn't have to worry about the drive early in the morning. Just seemed to make the most sense. The only thing really, I guess, funny about the night before surgery, other than the fact that, at least me, I did not sleep at all. I was just a ball of nerves, pretty much on the ledge, is that they had told me to make sure that you remove all of your jewelry, prior to surgery. And I thought to myself, well, I'm not going to wear any jewelry. Like, who does that? I don't have any piercings anymore. And I just thought, well, I don't have to worry about that. Well, I was laying on the bed, and my best friend said, wait a minute, what about your toe rings? And I was like, oh, do I have to remove those? And she's like, duh, yeah, you do. So probably the most painful part of most of the surgery was having her try to take 8 toe rings off of my toes, which probably had not been removed in at least 2 years. And there are a couple of them, you're coming around the toe and they just don't want to move, and that was a little bit painful. So anyway, the morning of surgery, I woke up, put my game face on, and thought, okay, I'm going to do this, and I'm going to try to stay as strong and, put together as possible. When we got to the hospital, they first took me upstairs to a room where they needed to take an EKG, and then they had one other blood test they wanted to do. I hadn't had my thyroid, my TSH levels tested yet, so they thought they would do those before surgery, and then they would go ahead with the IV. Now, typically, I'm the kind of person that when I have to do a blood test, I ask to lay down, and I ask for a butterfly, and I tell them, please only use my right arm, because it just seems to work. Well, the nurse, for some reason, was convinced that she could put an IV into my left hand, and spent a great deal of time prodding, pushing, moving. I mean, the pain was just awful, and I started to really get upset, and that just kind of wasn't a good way to start off the day. Like, you go in there and you're thinking, okay, I can do this, and then, the first thing that you encounter is something that's, not easy by any stretch of the imagination. So they decided to wait until I got upstairs to the OR to do the IV, which is actually a very good thing, because once I got up there, the surgical nurse actually numbed my hand, like, duh, who would have thought of doing that, and then was able to put the IV into my good hand, the one that I had suggested in the beginning, with no problems whatsoever. The surgeon came in and told me that they had discovered in the blood test they'd done that morning that my TSH levels indicated that I had hypothyroidism, can't say that, which, I guess could help explain some of the reason for the fatigue, the inability to lose weight, all of those things. And when we're overweight, we're always looking for an excuse, and not an excuse, but something to kind of help us justify how and why we got into this situation other than just our own choices. So I was relieved in a way to hear that, because it kind of helped me understand. And the doctor said, after your surgery, we'll put you on thyroid medication for 3 months, and then we'll see what happens after that. So I was pretty nervous. Dr. Sarangel requires that you walk into the OR room yourself, and I think it has something to do with, circulation, good for your circulation. And when I walked into the OR room, it kind of reminded me of a dentist chair, to lay down on, and the anesthesiologist, who was great, said, "Come on down, I cooked you up the perfect cocktail, and it's happy hour." And that was pretty much the last thing that I remembered. So I woke up, and most of the day on Friday I was really kind of out of it. I remember bits and pieces of conversations, but now, like, I think back and I had to ask my family members, like, did that happen? Was that said? Because I'm not sure that I heard that correctly. What ended up happening, and just to kind of sidetrack a little bit, for the last at least month, I have been having severe upper abdominal issues related to my gallbladder. And one of the things that really pushed me to commit to the surgery was knowing, hey, I was going to need a surgery anyway. I was going to need to have holes poked in my tummy and have the gallbladder removed. And so then I thought, well, while they're at it, why not just yank out about 85% of my stomach? It just seemed like killing two birds with one gallstone. Ha, a little humor there. So the doctor, when I woke up, at least when I woke up and I was able to understand the English language, he told me that they had removed the gallbladder, but it had taken the surgery 3 hours. Typically, VSG is, like an hour and a half? But because my gallbladder was for some reason, it was underneath my liver, and it was very difficult to get to and to get at and get removed. But he felt my gallbladder was so sick that it really needed to come out. He didn't want to wait and have me come back, a month, 2 months later and have to go through the surgery. So he removed it, and I had, 3 hours of anesthesia pumped into me. So I guess now I kind of understand why, at least the first day I was a little bit hazy. The nurses didn't even ask me to get up and walk, only to the bathroom, which that was fun. Everybody hates having to ask somebody for help to go to the bathroom, and it seemed like with me I was peeing like a racehorse, which I guess is good, because the more you get out, the less you bring home with you, maybe. So by typically Dr. Serangle, about 90% of his patients only stay 1 day. There is no drain bag, there is no leak test. The incisions are very small. I had 5 incisions. The largest one by the belly button, probably where both the gallbladder and the stomach was removed. But they had also done another blood test on Saturday, and there was something in my liver that was causing him some concern, and so he said that I needed to stay an extra day. So I ended up staying 2 days, which I guess is okay. I got a little extra rest, but I'm kind of one of those people, this was my first surgery, so I haven't spent a whole lot of time in a hospital, and I'm not sure that I really want to. I was anxious to get home because I guess maybe that made me feel like I had a little bit more control over this situation, and, by getting home, that meant that I was on the road to recovery. By staying in the hospital, I felt like, okay, I'm still sick, or I'm still, I'm not starting my journey just yet. So I did go home. I'm pretty fortunate. The first night, had a little bit of gas, and I didn't know what it was because I never really had trapped gas before. So I was up most of the night, nervous, like, oh my God, my stomach's going to explode, or, something happened and now my liver has fallen to my uterus, or, just something really just dumb, but it was scary. And then along the way, it eased up. And that's the only episode of gas that I've had, and knock on wood. I don't think I have any trapped, because I know it's coming out on its own and it's not causing me any pain, so I'm very grateful for that. I worked really hard to get off of the pain meds early. I actually didn't really need it too much. I would just take a little bit, and it was always like half the recommended dosage at night or when I wanted to take a nap. And today, it's Wednesday, I haven't taken any, and I don't know, I'm not saying that I won't take it. For me, it's something that again, makes me feel like I can get clear-headed again, and that's important to me. I had bought a little, well, not a little, bought a long body pillow, and it's behind me. It's zebra print. Initially, I thought it was cow print, and I thought, well, that's not very good, you know, an obese person going in for surgery with a cow print pillow, but it's zebra. My sister told me so. And that thing has really been helpful. I actually have been able to sleep fine. I can sleep on both sides. I can sleep on my back, not quite on my stomach, kind of like that side stomach I can do. So I've been pretty comfortable. I have a little incision pain, more like, you know, I've done a million sit-ups, or I have a little side ache, but, you know, nothing that I can't work with. I'm struggling to get in, you know, the fluids. I have to do 70 grams of protein, and I just reached it today, so it took me a couple days to get there. It wasn't that I was that far off. It was just trying to get used to the different combinations of what I like and how I can add protein to things, and just learn and what works for you. And I found a few things that work for me. One of the things I discovered being home, especially during the day, there's a lot of food commercials. And I didn't realize that because I DVR everything. And so I guess maybe one of my first tips is, if you're an evening television watcher and you're prone to the, well, while I'm watching TV and I see the commercials and it's all about food and I'm going to go to the kitchen, maybe it'd be wise to invest in a DVR so that you can just fast forward through all the commercials. Kind of like out of sight, out of mind. I don't know. I really did not realize how many food commercials there were until I started watching live TV. The other second tip I would say is, if you can, really consider who you pick as your support partners in your journey. And sometimes they can be different. Like, who's there for you pre-op can be very different who's there for you post-op. And most of you, if you're married and you have a spouse, you don't really have a choice. I had my mother, my sister, and my best friend. Now, my sister had lap band 3 years ago, very frustrated with the whole thing, lost some weight, put a lot of it back, and, you know, isn't real happy with it. So she has her own set of beliefs and, you know, thinks that she understands how the system works. And then my best friend, who's a nurse, which I thought would be great having her there, she is an 11 years RNY patient, has been very successful at it. But it's interesting because if your support partner doesn't take the time, even if it's just a little time, to learn about your particular experience, you know, whatever surgery you select, I think it's not helpful, because when you're in pre-op, when you're in post-op, you get all of these ideas and thoughts thrown at you. Well, you should do this. You should try this. Why can't you do this? And it would be nice to have had someone who would have taken the time to just have learned a little bit about what to expect, because I spent a lot of time, and I love my best friend and I love my sister dearly, but I spent a lot of time like listening to what one thought and then what the other one thought, and then my having to go, okay, let me tell you how it works. A little bit of a distraction. I love them both, and I know that they were there in love and support. But if I could suggest anything for any of you who are getting ready to go through surgery, just ask that your partner learn a little bit about what you're going through and what it's going to be like afterwards. Lastly, I just want to say thank you so much to all of you out there. You guys talked me down from the ledge. I was so scared the night before. I don't think I ate anything, you know, like, even though there was the 48, I had a 48-hour liquid diet, I couldn't eat, like, I couldn't keep anything down. My stomach was just a mess, and all of your comments and you'll get through this and everything will be fine, and, you know, and you know, Phil's comment about 95% of your fear is of the unknown, and the other 5% morphine can kick its ass. You know, you were right, and I knew you were right. I didn't doubt it. I just was afraid that it wouldn't be my experience, and in the end it was. And I just want to thank you so much, because you were courageous for me when it was hard. And I don't want to be a cry, whiny baby right now, but I just have so much love and appreciation for you people. And I'm looking forward to now being on the same journey as you are, and much love. So on Friday, I will update with all of my stats, and I guess it's on. It's on like Donkey Kong. So I'm excited, and my new life, or the new rest of my life, has begun, and best of luck and best wishes to everybody else. God bless.